Hello, I am Dr. Charles Gardner, Medical Officer of Health at the Simcoe Muskoka District Health Unit, here to provide the COVID-19 update for Simcoe Muskoka. So as of today, we have 3,116 cases, which is up by 383 cases from a week ago, December the 15th, when I last reported. If we look at how things have changed from week to week, the week before we were at 310, the week before that we were at 333, and the week before that we were at 230. So we continue basically with a steep rise in cases, a little bit of a dip between two of those weeks, but otherwise a steep rise. I would like to say that we've had 3 people pass away, 3 cases since I last reported, and would like to express my condolences to the families of those people for your loss. One is a woman in her 80s, and one is a man in his 80s. Both passed away at Georgian Bay General Hospital. And one is a man between 45 and 64 who passed away at Toronto Western Hospital. All 3 lived in Simcoe County. The week of December the 13th, we had the second highest number of cases that we've ever had. So I think we're on track this week to be having the highest number of cases we've ever had. If we look at the last 44 cases over the last 24 hours, they are as follows. 41 of them were sporadic cases and 3 were institutional outbreaks. 18 were men, 26 were women. Their ages range from under 10 to over 80. 39 lived in Simcoe County, 2 in Muskoka, and 3 unknown at this time. 2 were acquired in the community acquired cases. By that we mean we don't know how they were acquired. 5 were from close contacts of other cases, and 34 under investigation, and 3 were part of institutional outbreaks. 43 are presently under self-isolation, and one has recovered. We've had a steep rise in the number of active cases over the week. So presently we have 623 active cases, up from 395 the week before. So quite a substantial jump. We have 2,418 cases that have recovered. 18 of our cases are hospitalized, up from 13 the week before. Those hospitalized range from under 10 to in their 90s. 18 are from Simcoe County, 2 are from the District of Muskoka, and 7 of these cases are in the intensive care unit. Currently we have 22 outbreaks. 2 are in long-term care facilities, 3 are in retirement homes. 1 is an outbreak in a hospital, 1 in a correctional center, 6 are in congregate settings, and 6 are in schools, educational settings. 1 is in a workplace, and 1 is in the community. If we look at our institutional outbreaks, I'm going to be going over them in detail, but just the highlights of what's new and which ones have been discontinued. We have 1 new one at Villa Retirement Home in Midland, and 3 that are declared over: Bradford Valley, Mill Creek Care Center, and the Waterford Retirement Residence. If we look at our congregate settings, we have 7 outbreaks, up from 5. So of these, we have 2 that are declared over: 1 a hospice in Simcoe County, and 1 group home in Simcoe County. If we look at our workplace outbreaks, we have 1 new one, a veterinary service in Simcoe County, and 3 that are declared over, 1 an essential service in Barrie, 1 a public administration, the post office in Barrie, which they had publicly declared, and 1 food and beverage establishment, Loblaws, which had self-declared in Collingwood. So those 3 are now over. We have 6 educational institutions in outbreak, down from 7. So if we look at the details, they are Bradford District Secondary School, Bear Creek Secondary School, St. Joseph's Catholic School, Barrie North Collegiate, and for elementary schools, Portage View Public School in Innisfil, and 1 child care center in Innisfil, and we have 3 that are declared over now. Nantier Shores Secondary School, Our Lady of Grace Catholic School in Angus, and St. Mary's Catholic School in Innisfil. And we have 1 outbreak in a community setting, a church in Barrie. We've actually had 2 church outbreaks to date. So the vast majority of these cases are concentrated in South Simcoe and in Barrie. If we go to the lower tier municipalities, Bradford, West Gwillimbury, New Tecumseth, Essa, and Innisfil. But we've had substantial cases in other parts of Simcoe County as well, most recently in Penetanguishene, with the outbreak happening at the Central North Correctional Center, and I'll get into more details about that. And in Muskoka, Huntsville, and Gravenhurst have had the highest number of cases in December that they've had in any specific month since the beginning of the pandemic. So we are seeing some rise now in Muskoka. In terms of schools, we have a total of 163 cases that have resulted in exposures in schools, with a total of 17 outbreaks declared to date. If we look at our dashboard, we remain this is the Health Unit's dashboard, not the province's framework. We remain in red status. We continued with a red status for laboratory testing, and this is due to the slow turnaround time in laboratory tests within 2 days, and our percent positivity of tests has gone up to 2.2 from 1.8. Percent positivity is a measure of a combination of how common the virus is, how frequently people test positive, versus the amount of testing that we're doing. So we've remained below 3 so far, which is an international standard in which things become more concerning, but we are increasing. Our health system capacity remains unchanged at yellow, although I did note that we have had an increase in the number of cases of COVID-19 hospitalized in Simcoe, Muskoka. And our public health capacity is challenged, has been for a long time now, remains at red, and in fact our ability to be able to reach cases within 24 hours has declined down to 57%. Our target is 90%. And that's down from 74.2% the last time I reported. This is a reflection of the amount of cases that we have now, and because we've had delay in our ability to reach cases, and because we've had to simplify the data that we take on our cases, we can no longer report on in a meaningful way our reach to the contacts. We've had to ask cases to follow up and inform their own contacts if they can, using a script that we provide them from our website, but we can't meaningfully indicate, therefore, the reach of contacts within our framework. In terms of the trajectory that we're on, our incidence of cases per 100,000 population per week is up to 57.9 from 53.2 last week. Anything above 40 would be in keeping with the province's framework for a red status. Now, the province has put us into a shutdown now, and I'll get into more detail about that later. So they've essentially, for the moment, put on hold their framework, but by that framework, we would definitely be in the red. Just to make a comparison, the province's incidence per 100,000 population per week is up now to 104.2 from 89.9. So it's gone up more steeply than our cases have locally. Our average daily growth rate is slightly down at 1.7% per day from 1.8 a week ago, and actually above the provincial rate at 1.5. Our reproduction number is 1.2, so anything above 1 means that it's growing. The pandemic locally is growing. And our doubling time has remained stable at 42.6 days. So if we continue with this rate of growth, in 42 days we'd have twice as many cumulative cases as we've had to date. So less than a month and a half from now. Okay. Just turning to information about our outbreaks. So Georgian Bay General Hospital in Midland continues with an outbreak in that hospital. They have posted that they have 24 staff cases, which is up from 19 when I reported a week ago. And they have 23 patient cases, up from 13 when I reported a week ago. We have only been able to input 19 of those cases due to the challenge of keeping up with the numbers ourselves, the volume of cases, so that data will be entered, but only 19 of them are in our database and reported on our website. And they've had one case in a visitor as well. So they continue with their outbreak measures. They've had 3 cases now deceased. One female between the age of 65 and 79, one female above the age of 80, and one male above the age of 80. And as a health unit, we continue to work very closely with them, with their senior management, with their infection prevention and control team, to do all that we can, what they can, to bring this under control. But it is a very challenging situation. Once you get an outbreak in a facility with a significant size, it can be very challenging to bring it under control. Certainly there's testing happening of the staff and patients in the affected parts of the hospital. And as I indicated before, there was an infection prevention and control review by Public Health Ontario done earlier in the month with no identified major gaps. The Coleman Care Centre in Barrie had an outbreak declared on December the 10th. They have one positive staff case, which is unchanged from when I last reported, and negative test results on staff and residents at the facility. Raglan Village Retirement Home in Collingwood had an outbreak declared on December the 12th. They have one positive resident case, unchanged from when I last reported, and testing results have come back negative on the staff and residents of the facility. Kingsmere Retirement Home in Alliston has 4 positive residents, up from 2 when I last reported, and 3 positive staff, up from 2 when I last reported. Otherwise, negative test results in the residents and the staff. Trillium Manor Long-Term Care Facility in Orillia outbreak declared on December the 14th, has 6 positive staff, up from 1 when I last reported, and 5 positive residents, and there were no resident cases a week ago. So extensive testing happening at that facility of staff and residents awaiting results. The Central North Correctional Center in Penetanguishene, outbreak declared on December the 14th. They presently have a total of 21 positive cases, up from 3 when I reported a week ago. So 3 staff cases up from 1 when I reported a week ago, and 18 cases in inmates, up from 2 when I reported a week ago. Testing being pursued in the residents and the inmates in the affected unit. Villa Retirement Home in Midland had an outbreak declared on December the 14th, with 1 positive staff case that is unchanged from when I last reported, and test results of the residents and the staff in that facility being negative. In terms of the educational settings with outbreaks, we have Bradford District High School with 5 cases. This was declared on November the 27th, and so 5 cases, which is unchanged from when I last reported. We have Portage View Public School in Innisfil declared on December the 3rd, with 5 cases, up from 4 when I reported a week ago. Bear Creek Secondary School in Barrie declared on December the 9th, with 8 positive cases, up from 6 when I reported a week ago. St. Joseph Catholic High School in Barrie, outbreak declared on December the 11th, with 4 positive cases, unchanged from a week ago. Barrie North Collegiate Secondary School had an outbreak declared on December the 14th, with 3 positive cases, unchanged from when I reported a week ago. We have a child care center in Innisfil, outbreak declared on December the 21st, with 8 of the clients, students, and 1 staff as actually, and I'm gonna have to correct myself, 3 positive cases, a total of 3 positive cases, and so that was declared on December the 21st. In terms of congregate settings, we have a group home in Simcoe County declared as an outbreak on November the 30th, with 32 positive staff, up from 30 a week ago, and 19 positive residents, up from 18 a week ago, and otherwise negative test results on the remaining staff and residents. A group home in Simcoe County declared as an outbreak on December the 9th, with 2 positive staff cases, unchanged from a week ago, and negative test results in the residents and the staff otherwise. A group home in Simcoe County with an outbreak declared on December the 12th, with 3 resident cases, up from 1 a week ago, and 1 staff case, which is unchanged from a week ago. And otherwise negative test results for the residents and the staff. A group home in Simcoe County declared as an outbreak on December the 20th, with 1 positive staff case and on-site testing taking place. A group home in Simcoe County declared on December the 20th, with 1 positive resident case and testing being done otherwise for the staff and the residents in that facility. A group home in Simcoe County declared as an outbreak on December the 21st, with one positive staff case and otherwise no other cases, testing taking place for the staff and the residents. In terms of community settings, one church outbreak in the city of Barrie, declared on December the 18th, with a total of 7 cases and investigation underway. So some points for the media. Today is a historic day for us in Simcoe, Muskoka, as we commence with the opening of our COVID Vaccination Clinic in partnership with RVH in the city of Barrie. This morning we had our very first vaccination take place with a volunteer staff member from Victoria Village, Lori Black, and I'd really like to commend her for her outspoken support for vaccination, for COVID vaccination, for the safety of long-term care facilities. It is going to be greatly augmented as we're able to proceed with vaccinating the staff, and when we're able to also then the residents of these facilities. So this is, as I said, historic. It's the very beginning of a campaign that will carry through for most of next year, I anticipate, as we get more and more vaccine and are able to continue to provide vaccine at this time by invitation, by booking, for initially staff in long-term care facilities, followed by staff in retirement homes. We potentially could go on to vaccinate at that site for hospital employees, though we're hoping in the near future to have a type of vaccine that we can move out to other locations to be able to provide on site. So once we're able to move vaccine to other sites, we'll be able to take it to long-term care facilities, retirement homes, hospitals, other congregate settings in order to protect the residents, the staff, the patients of those settings, and very much a focus at the very beginning with the first of the vaccine on those who are most vulnerable. Certainly well over half of the deaths that we've had in Simcoe, Muskoka and elsewhere in the Western world have been in long-term care facilities. So in addition to all the other protective measures that we have in place, this would be very definitive to be able to get to them and vaccinate them and protect them. The Pfizer vaccine, the one that's been approved, has been shown with its trial to be highly effective for seniors as well as other age groups, well over 90% effectiveness or efficacy. So that will be extremely helpful to us. I look forward to being able to proceed with that. I would also say that we anticipate in the near future the Moderna vaccine being approved by Health Canada and then made available for us to use, and we anticipate that it's a vaccine we can move elsewhere, move off-site, and be able to get much bigger coverage that way. So today's the beginning of all of that. Eventually we'll have vaccine that would be able to provide with partners in the community, such as primary care, community pharmacies, emergency medical services, to the broader community eventually, and make it available to all who would qualify. At this point, it would be adults, people above 16 and above who would qualify. Once we get enough volume of vaccine, we anticipate that that would be coming later in the year, beyond the first quarter of the year, potentially beyond the second quarter of the year. We'll have to wait and see how that unfolds. But today is the beginning of all of that. I was present for that. I found it entirely moving to be there for that moment. I'd really like to commend everybody involved for having achieved that, having been able to bring that here. So certainly commendations to the whole effort to create these vaccines in the first place and to be able to get them to us. But I'd really like to commend my own staff. Many of my staff work extremely diligently to prepare for this. We had to redeploy many of our staff, our nursing staff, to administer vaccines. So they are working in this new clinic right now. And certainly a lot of work on the part of management here to prepare for all of that. RVH played an absolutely indispensable role in being able to receive this vaccine. It's a technically demanding vaccine. It requires ultra cold storage at -70 degrees centigrade. That requires a special freezer unit that RVH has, and so they were able to contribute that, and pharmacy support, and a lot of the logistics and IT and booking system. We have our own IT contributions as a health unit to this, but RVH has been indispensable for all of that. And I also note that the city of Barrie has been indispensable. The location is at the old police station site on Sperling Drive in Barrie, and that site is owned by the city of Barrie, and they did a great deal of work on site to be able to prepare this to be able to operate. So I really like to thank the city of Barrie as well for having this happen, being able to open up and be prepared the moment we could, essentially the moment we received the vaccine and were able to proceed. So very happy with all of that. And I look forward over time to giving updates about the vaccination campaign, and would certainly encourage people in your time when it is available to you, depending on your own circumstances, to receive the vaccine. It's been shown to be highly effective and very safe, very good safety profile from the trials, and ongoing close monitoring as well. As we enter this phase of provision to the population, they're very strong mechanisms in place for monitoring the safety and reporting on the safety of the vaccine. There have been some questions about how it works and how the approval process works. So from following the approval process and having participated in presentations on the topic, I've learned that the creation of this vaccine and its approval happened in under a year, which is remarkable considering that vaccines usually take several years to produce and get approved. And the reason why it happened that quickly is because of the strong imperative that we find a way out of this pandemic, and this is the way out of this pandemic. If it weren't for a vaccine, we would be having to deal with these control measures for many years to come. And so with this vaccine, it becomes possible, and with the other vaccines that are coming, it'll become possible to come out of this and have people protected, get 70% or more of the population protected with this vaccine to break the chain of transmission, and eventually, I believe later next year, we'll be able to back out of many of the control measures that we have in place and have more normal lives. So there was an incredible imperative that we be able to develop vaccine as quickly as safely possible to allow for that achievement. And so Health Canada worked very closely with the vaccine companies in monitoring their progress in the development of the vaccine, and as they move through the stages of testing the vaccine, they used an overlapping process in the stages so that after they got enough data from one stage about its basic effectiveness and safety, they could then go on to the next phase and then continue on with the next phase, and would have rolling submissions to Health Canada about the data that we're finding and getting live time feedback and requirements from Health Canada to augment their studies to answer key questions that Health Canada was identifying as they were proceeding. So that would enabled progress on the vaccine to happen much more quickly than in the past. And also there had been prior work on similar viruses, other coronaviruses in the past that they were able to build on at the very beginning. And also they were able to identify the genetics of this virus, the COVID-19 virus, very early in January with modern genetic sequencing techniques. All of that helped to greatly shorten the development process and the approval process. Health Canada, or I should say the federal government, is in contract with a total of 7 different types of vaccines, and so we have 1 approved to date. We expect another soon from Moderna, and there are others coming as well, and so I look forward to seeing progress on those other vaccines, because more of them will be helpful to us to be able to be easier to administer broadly to the population. So the Pfizer vaccine, and for that matter also the Moderna vaccine, are based on a new vaccine technology, messenger RNA or mRNA vaccines. And they work by containing a type of genetic code called messenger RNA that is encapsulated in a lipid membrane, a type of coating that when injected into the body as part of vaccination are admitted into the cells of your body and stimulate in your cells the production of the spike protein that exists on the surface of the COVID-19 virus. And that spike protein is then taken to the surface of the cells in your body, where it stimulates your body's immune system to respond to it and develop antibodies and other mechanisms in your immune system, something we call cellular immunity, that then primes the body to be able to fight off COVID-19 if you get exposed to it, if you start to get infected with COVID-19. Because of this vaccination that you would receive, your body, your immune system is primed to be able to fight off COVID-19 when it encounters it. So that is how that works. It is a vaccine technique that is new for campaigns, new for our use in the public, but in fact it's been many years under development, really back to the 90s in which it was under development. So it's been a long time coming, but now we have it, and by its nature it was easier and quicker to be able to produce as well. So the very first vaccines that we have are messenger RNA vaccines. And they proved in clinical trials to be highly effective and to have a good safety profile. I'm going to be talking a little bit about the provincial shutdown. This was announced yesterday and takes place just after midnight, beginning the early morning of December the 26th. This will be in place for all of the province, all of the health units of the province, and is very wide in its application, and it would be in place for a full 4 weeks for Southern Ontario, including Simcoe, Muskoka, and 2 weeks in the regions in Northern Ontario. And it does include school closures, so schools into the holiday season would remain closed longer. The primary schools for an additional week to January the 11th, the secondary schools an additional 3 weeks to January the 25th. And it's important to note that childcare centers would remain open. Post-secondary institutions remain open for virtual instruction and with limited exceptions in-person instruction. There are additional restrictions with regards to gatherings. So outdoor gatherings are now limited to 10 people with no indoor gatherings beyond household contacts, people that you live with, or if you live alone, that you would be able to have that kind of contact with one other household. So this is now moved up to being a requirement. There is a restriction with the number of people who can attend funerals and weddings of no more than 10 people or less if the space doesn't allow for the physical distancing of 2 meters. Restaurants and bars, food establishments are now operating as take home or take out and delivery only. Retailers for food, pharmacy, alcohol, and safety products and prescription eyewear are open with limitations for floor space. Other non-essential retail are open for curbside pickup, including in malls, except for outlets in malls that fall into the category of the food, the essential retailers such as food and pharmacies. Manufacturing, agriculture, food production, construction, resources and energy, essential community services are open within safety specifications. Libraries open for curbside pickup, and closure of amusement parks, tour and guide services, zoos, museums, casinos, gaming and bingo establishments. In terms of hospitality and tourism, outdoor recreation is permitted only if a person using the amenity can maintain a physical distance of 2 meters from another person. And so no team sport practices or play, no open change rooms, locker rooms, showers, or clubhouses, with the exception of washroom or first aid. In terms of outdoor recreation, snowmobiling, cross-country skiing, dog sledding, ice skating, and snowshoeing, tobogganing, and outdoor parks and recreational areas are open, but downhill ski hills will be closed when this takes effect. With regards to personal care and health care, organizations that provide health care, regulated health professions, including medical, dental, physio, massage, mental health, organizations that provide food, shelter, safety, or protection and or social services for disadvantaged and vulnerable individuals remain open. Hairdressing, barbershops, spas, and nail salons will be closed. So we will update our website and make sure that we have as much information as is necessary to keep people informed and make clear the details on these requirements. As I've indicated before, we are challenged now with our case and contact management because of the volume of cases. Our goal is to get to people within 24 hours. We're now finding a significant number of cases can be delayed by 3 days or even more. Certainly we very much regret this, doing all we can to deal with the situation, but I think it's important for people to be aware there's now a delay. And so for individuals who have symptoms of COVID-19, I always say that you need to self-isolate and seek testing and remain in isolation while you await your results. And if your results come back positive now, we may be delayed in being able to get to you, and so you need to continue with your isolation. And we now recommend that you actually notify your household contacts, advise that they go into isolation and seek testing as well while you await contact from us. Important for people to be aware now of our limited ability to get to people in a timely way. We do have information on our website that can help advise people about cases, about how to advise their contacts. I would like to wish all of you the best of the season, the holiday season. I wish for you a restful and restorative time as much as is possible. I know that so many of us are very busy right now in responding to the situation. I certainly acknowledge that for my own staff. I wish you all the best. I wish for you that you can have meaningful contact with those you love, but it needs to be done remotely from a distance or outdoors with distancing in limited numbers, less than 10 or less, and otherwise direct physical contact with people who are in your household only, or that if you live alone, you essentially adopt one other household for that kind of contact so that you can avoid the kind of profound loneliness that would otherwise happen to people who live alone. With the new shutdown regulation coming into effect, there's strong advice for people to limit their trips out of their home for essential reasons: work, school, groceries, pharmacy, seeking health care, daycare, assistance, childcare, providing assistance to vulnerable individuals in your life, and physical activity. Otherwise, people should not be allowing other people to be visiting their homes unless you've got that arrangement with one other individual who lives alone. And I know that this is by no means normal for us. This is very hard on us, especially at this time of year when it's normal for us to have loving, gathering get-togethers with people, arrangements with people that we're close to. It's just not going to be a normal holiday season. I regret it, but it is essential that we take this very seriously. I've talked of the light at the end of the tunnel with vaccination, and I would say that while that's cause for hope, it's going to be months in the making before we get to everybody, and therefore people need to redouble their commitment to the control measures that will otherwise help to keep this under control, keep it at bay, to prevent you from contracting this, to prevent you from transmitting it to other people. So at this point, I would be happy to take questions or comments.
Okay, thank you, Dr. Gardner. Marge Bruman from the Barriers Today. Go ahead, please.
Thanks so much. I'm all about the vaccine at the moment. I'm wondering what the process is for the movement of the vaccine arriving in this area, through this area. So you had mentioned earlier that there was a refrigeration unit at RH. I'm wondering if there were more, or if that existing unit has been moved to its further location, and what the, I guess, stage of one process is, if you could break that down a little bit more for me.
So let me just see if I got your question right. You would like to know more about the process by which we manage the vaccine, its arrival, that kind of thing?
Yeah.
Okay. So we get the shipment originally from the federal government, provincial process, as well as to who gets it throughout the province. So we've been fortunate the province has identified us to receive it this week. It's by no means happening everywhere in the province. The focus has been in the areas that were formerly designated, well, actually presently until Boxing Day, presently designated as gray or red. We're in the red, so we're getting it. It arrives in a kind of package that keeps it deeply frozen between -60 and -80 degrees, in part with the use of dry ice, frozen carbon dioxide, very high-tech means. It's taken to where it will be stored, the deep freeze unit. We are, for security reasons, not disclosing exactly where that is, nor are we disclosing exactly how much we received, nor would we be disclosing when the next shipment would arrive. But there's a protocol for checking it through technical means when it arrives to make sure that the cold chain of transmission was never broken. So they go through that kind of technical check that does involve electronic communication back to the manufacturer. And then after that has passed, pharmacy personnel from RVH who've been trained in handling it move it expeditiously into the deep freeze unit and store it there. That deep freeze unit has continuous temperature monitoring of its interior to make sure that the vaccine is never allowed to warm any warmer than minus 60 degrees centigrade, and otherwise to remain between minus 60 and minus 80, preferably at minus 75. And then once we are preparing for the actual administration of the vaccination to people, it takes 3 hours for that vaccine to thaw. So once again, pharmacy personnel handle that vaccine to bring it out so that it's allowed to thaw. If it is thawed up to fridge temperatures, it can be kept up to 5 days and would still be viable for use. Once it's brought up to room temperature, it can be kept for 2 hours. Once it's been processed, we have to take the vials and add what we call normal saline solution, a sterile salt solution that's commonly used in medical care. Add the required volume of that to the vials. Once that happens, it can be used for 6 hours. Clearly, we don't want to waste any of this vaccine, so there's a great deal of effort put into being precise about how much vaccine is brought out to be used. And we have pre-booked people identified from our long-term care facilities through outreach communication that we did last week, and through a booking process that RVH is managing to have the people that are going to receive it and their time that they're going to be receiving it booked, and for them to know this, for them to come down to the clinic at the right time, and then they come into the facility and are assisted in making sure that infection prevention and control is maintained through hand sanitization and the provision of the appropriate medical mask and spacing when they're present at the site. And then they in their time are brought through to the vaccination bays, where they're given the vaccine after having gone through a question process about contraindications and informed consent. It's a very elaborate process. It took a great deal of work to set it up in the first place. And yesterday we did a trial run of it, a mock run or dry run, to identify any flaws in the system to be corrected. After they're vaccinated, they go into an aftercare location with chairs spaced appropriately, at least 2 meters apart, where they're monitored for 15 minutes, and then they're given appropriate documentation that they've received the vaccine. They're given a booking for returning in 21 days. This is a vaccine that requires 2 doses, so they get that before they go, and then they leave.
Oh, that's fantastic. Now, the other thing that I think is, so many things interesting here, but the other one I think that everybody wants to know is how this rolls out after phase 1. I mean, you said earlier that, you really had hoped to get the long-term residents access to the vaccine as soon as possible. So I'm wondering what the overall local process might be after phase 1 to get it to the larger public, particularly the more vulnerable people.
So that would be absolutely essential that we be able to do that. And this is actually all part of phase 1 according to the province's phases as they see it. So I guess what we're doing now is the very earliest of phase 1. And because the vaccine cannot be moved far from where it is stored, we're limited to providing this vaccine to people who can come to us. So therefore we're limited to staff of these facilities. But the Moderna vaccine is anticipated to be able to be moved. So once it's approved by Health Canada and we receive it, we'll be in a position to be able to move it to long-term care facilities and retirement homes and then hospitals and home care potentially. We shall see. It's just easier to move it. It only requires minus 20 degrees centigrade storage and has much longer shelf life in fridge temperatures as well. So it'll be a vaccine that we can move, and what we intend to do is establish liaison connections with our staff, our nursing staff, to those facilities, and have the vaccine shipped to them, and have personnel at those facilities administer the vaccine to the residents and to the staff. So it all depends on getting vaccine that can be moved. It's also possible that through further study from Pfizer and review with Health Canada, that they might decide that the Pfizer vaccine can also be moved. So if that happens, then we'd be in a position to be able to move it as well. Some of the retirement homes don't necessarily have the capacity to be able to administer the vaccine themselves. They don't have personnel to do that. So we're looking to partnership potentially with emergency medical services or others through Simcoe County or the District of Muskoka. This is something we need to communicate and develop with them. They've indicated that there may be the ability to do that. So we have to work that out. That will need to be in place as we proceed with this. So all of this has happened earlier than any of us anticipated. The earliest communication that we had was that vaccine would be available late in 2021, and then more recently early in 2021. But to have it available now, it has been a great blessing, but also a great challenge for us in setting all of these processes up.
Excellent. Thank you, Mark. Thank you, Dr. Gardner.
You're welcome.
Erica Engel from Collingwood Bay, go ahead, please.
Hi, thank you, Dr. Gardner. You've mentioned a steep increase in active cases. The province reported today there's now more than 1,000 people hospitalized with COVID-19. I talked to the local hospital here who said, she's excited about the vaccine, but a little nervous for January based on the modeling numbers that came out from the province. How are you feeling as we head into January with the modeling numbers, but also facing a provincial shutdown?
Well, we face a very serious situation in this province. The entire world, for that matter, faces a very serious situation with COVID-19. Internationally, the cases grow day by day more than what they've been the day before, right? By the daily rate goes up, so it hasn't peaked internationally. It's certainly not peaked in Ontario. We continue to have a rise in cases. I believe our rise would have been much steeper still had there not been the provincial framework and the restrictions that were done at a regional level to try and control it, but it's still rising. And the projections from the province are always of concern. They're always a warning to us about where things could be. And here in Simcoe, Muskoka, we continue to rise in our total cases, and also our geographic spread is happening within Simcoe, Muskoka. So much more in the way of cases in northern Simcoe. I'm seeing now more cases as well in Muskoka. I think it's a warning to us that we need to, on a personal level, abide by the physical distancing measures, the use of face coverings, restricting ourselves to household contacts for close contact, and taking precautions when we go out, limiting ourselves for when we go out to the essential purposes, and being very cautious in our work environment. Employers need to be cautious in the work environment. We've seen lots of workplace outbreaks. We've seen community outbreaks. We've certainly seen outbreaks in households related to people's social circles, their gatherings, and people really need to abide by restricting themselves to only their household, even though it is the holiday season. When we had post-Thanksgiving, we had 15% rise in our cases. It was related to COVID, to gatherings and transmission in households. And we could very easily see the same thing happen again over this holiday season if people don't abide by these measures. They have to take it personally and take it very seriously. Right now, our healthcare system here in Simcoe, Muskoka is intact. It's not overwhelmed, but we are seeing some growth in our numbers. And I think we need to take note of what could happen by looking to the municipalities south of us, where hospitals are very heavily burdened with COVID-19 cases, including in their intensive care units. The projections show that we could easily have a steep rise in ICU cases, and if that goes beyond a sustainable threshold, then that actually threatens more lives, as people would be challenged in their ability to get that kind of care. So we in no way want to end up in that situation in Simcoe, Muskoka. It's really up to us all to work hard to avoid that kind of situation.
Okay, and regarding the number of active cases, what is the danger of us seeing that number rise, of having more active cases in the community?
Well, it goes up. Essentially what you get is a series of slopes, rises, waves that happen. So the first wave is transmission to people as cases, and following that, people get sicker and end up requiring hospital care. So that's your second wave. And then among those that get admitted to hospital, you have some who deteriorate and end up in the intensive care unit. So that's a third wave. And then among them, there would be a number that would require ventilation, beyond a ventilator. And then beyond that, you would start to see deaths happening. You also see deaths happening in long-term care facilities. Most of all, that it becomes another wave, a wave of outbreaks in long-term care facilities. But it all begins with cases in the community, transmission in the community. That's the first step for all that follows, all of those very unfortunate events. So it goes right back to what can we do as individuals to keep ourselves safe and avoid becoming part of the chain of transmission.
Okay, thank you, Dr. Gardner. Allison Brown. Oh, sorry about that. Allison Brownlee from the Muskoka region.
Yes, thank you very much. Dr. Gardner, what would you say to Muskoka residents and businesses who may feel that the provincial restrictions, especially around timing, duration, businesses affected, are arbitrary?
Well, I would say at this point in time, the province is taking a whole of provincial approach for the moment, for the next month, 4 weeks. They're applying this very broadly, so for the next 2 weeks it's the entire province, and then beyond that it's Southern Ontario. And we happen to be at the northern end of Southern Ontario by their definition. They've taken that approach because of concern about interregional spread, people traveling to other areas and enabling transmission to spread to those other areas. By taking health unit by health unit approach with their framework, only got so much progress. They're able to blunt the rise of transmission, but not to stop it. So it did continue to rise, even though they had that approach, and to a large degree, many of us feel it was related to people moving from high transmission areas to lower transmission areas to take advantage of the open businesses and venues that were continuing in those areas, and therefore spreading transmission, and also even spreading transmission among people coming together from those areas and going, from the high transmission areas, from the red and gray zones to other areas. If they meet together there to do these things that they can't do at home, then they transmit among themselves, take it back, and contribute to the rise of cases in their own communities. So, you know, I believe it's necessary to take this step if they really want to bring this under control. The hospitals and communities just south of us are seriously challenged at this time and are going to be much more challenged, I think, in the weeks to come, and certainly would be very much challenged without this kind of approach. I would also say that we witnessed within Simcoe, Muskoka, the ongoing migration of transmission north within our territory, and we're seeing it in Muskoka as well. So although their case count and their rates are lower than Simcoe, they are rising quite rapidly, and I think that needs to be a warning to people throughout Simcoe, Muskoka, and in Muskoka. The cases that we've seen have been a combination of close contacts with known cases and community cases where we don't know how they got it. It hasn't been from single large outbreaks.
Thank you. And you've addressed questions I had around the vaccine and timing. Follow-up. Should people be excited about this vaccine given the international stories we've heard about mutations already?
Certainly the stories of the documentation of mutation and new different strains of the virus are of concern. The data, both reported in the media but also through communication that I've had with researchers at University of Toronto, is suggestive at least that this new strain that's been identified in Britain but affecting other parts of the world is more transmissible, not more deadly or virulent, and there's no reason to believe that it wouldn't be just as responsive to the vaccines, but it appears to be more infectious. So efforts are underway to try to contain it, but I think it'll be very hard to contain it, and I would expect ongoing spread of that geographically despite those efforts. And so that really drives home the point that people need to practice the infection control measures. This has been all the way along a highly contagious virus. The control measures that we've used have only affected it to a degree, and it's really taken countries very severe control measures when you've got a full-on second wave or during the first wave, severe control measures that really bring it back down again. And while we've been doing these varying measures, we found that the transmission of other respiratory viruses, including influenza, have completely dropped. So the things we've been doing to try and stop COVID-19 and having had mixed impacts have been highly effective against other respiratory viruses. That really tells you just how contagious this virus is, let alone a strain of this virus that is potentially more contagious. But I'm a big fan of the vaccine. I think the vaccine is going to be vaccines, as more of them become approved and available for us to use, are going to be absolutely essential for us to be able to bring the pandemic under control and to have more normal lives. And it's very fortunate for us that the vaccines that are emerging have been shown to be so effective.
Thank you very much, and thank you to you and your team for everything you continue to do for your communities.
Thank you. Thank you very much for the acknowledgement.
Thank you, Allison. Brett Barber from Barrie 360. Go ahead, please.
Well, thanks very much, Kathy, and happy holidays to everybody at the house, man.
Thank you.
Dr. Tu, congratulations for on the vaccine this morning. That is monumental news, but unfortunately I've got to ask about this lockdown. You previously stated you don't feel that students need to be out of school for a prolonged break, but we're hearing that some won't even return to the actual classroom until January 25th. What are your thoughts on that?
Well, it is not what we advised. By we I mean many in the public health community, and my own view as well, feel that transmission in school has been very limited. It hasn't been a driver of the overall cases in the community. That school is important for children for their physical and mental well-being. And overall, it's really important that we strive to enable school to happen, to enable children to be able to go to school. I do note that for primary school, they're postponing it 1 week, so that is certainly better than if they had postponed that longer. I think younger children would be more vulnerable to the mental health impacts of withdrawal from school. They're also less susceptible to transmission to COVID-19. So I think it's a good thing that they're only a week. So to me, it will be a good thing overall when we're able to get our children back to school.
Thank you. And there will be folks who will look at caseload data next week and say it's proof that lockdown is having no effect. What do you say to them now? When will we actually see the results?
It will take between 2 and 4 weeks to really see a difference. And you will see a continued rise potentially within the first 2 weeks, because the cases that you see happening now became infected 1 to 2 weeks ago. So there's that lag in impact. And I would also say that even now, even though we're continuing to have a rise in cases, the rise is not anywhere near as steep or as high as projections suggested that were released at the beginning of November that really indicated that we could expect as many as 6,500 cases a day in the province by this point, instead of under 2,500 cases that we're seeing. So I think in part you'd have to look at what is the outcome going forward 2 to 4 weeks from now versus the projections. But eventually, we would want to see it actually peak and start to come down. So the experience in other countries that have done a very stringent shutdown or lockdown have shown results within 4 to 6 weeks with a substantial reduction. I would hope that we would be able to achieve that.
Thank you.
You're welcome.
Thank you, Brett. Andrew Mendler from Simcoe.com. Go ahead, please. Andrew, are you there? Okay, do we have anyone from CTV on the line today? Okay, how about Mark Claremont? Do you have a question, Mark?
Yes, I see that the numbers are finally in. I'm just concerned that the late date of these reporting. Could you comment on that?
That would be a direct result of us having high volumes and having a difficult time keeping up with them. So it's also affecting with the volume, the epidemiological processing data entry.
Whatever. And also, regarding the lockdown, so-called lockdown there, do you have unilateral powers to receive that? Could you declare a lockdown today instead of Boxing Day?
I think that it would be very hard for a local medical officer of health to make an order that would have that kind of sweeping magnitude, with that kind of detail that you get with provincial policy direction, directive, regulations. There's a lot of detail in the regulations that no local health unit or medical officer of health could recreate on their own.
How angry were you, or is it fair to say you were angry that the province delayed it until Boxing Day? Would you have preferred to have it ASAP?
Well, considering that projections show day-by-day impacts, every day that you delay has some impact on transmission, cases, and disease levels. And so from a public health point of view, earlier would be better.
Okay, thanks.
You're welcome.
Thank you, Mark. Is there anyone on the line who still has a question for Dr. Gardner?
Could I speak to another one, Kathy? It's Erica from calling today.
Sure.
Hi. So I'm getting some comments from people skeptical that cases being reported are really just infections and they might not have symptoms and therefore they might not be contagious. So I just wondered if you could comment on that concept of case versus infection, and if indeed the one who tests positive for COVID-19 is always going to be contagious.
What I would say is the majority of our cases are symptomatic individuals that this is a highly infectious disease, and so their potential to transmit to other people is substantial. A certain percentage, what I'll do is follow up with my epidemiologist to get the latest figure on that, but a certain percentage of our cases are without symptoms. They would be contacts of cases, people that as contacts have sought testing whether or not they have symptoms. So some of them would turn out to be positive without symptoms. Certainly there has been documentation of transmission from asymptomatic people. It may be that they're not as infectious, but they still carry a significant risk of transmitting to other people. And I would say that probably it's the opposite that's the case, that we miss more cases in the community than we know of, because some people with symptoms wouldn't seek testing. Some cases would not have symptoms and yet be able to transmit, but because they don't have symptoms, they wouldn't be seeking testing. There's usually more in the community out there than what we know about through the test positive cases that we've enumerated. And that takes you right back to the importance of people practicing in a universal way these infection prevention and control measures, the physical distancing, hand hygiene, use of face coverings in indoor public settings and work settings or outdoors when they can't distance, and to self-monitor, self-isolate, and get tested if they develop symptoms.
Okay, very much.
You're welcome.
Thank you, Erica. Okay, thank you, Dr. Gardner. So at this point, I'd like to wish everyone a wonderful holiday. I hope you have time to rest and relax and recharge your batteries. And we will see you in a couple of weeks.
Goodbye, everybody. Best wishes.
Bye.
And enjoy the holiday season safely, but enjoy it.